This is Glenn Fulcher with another issue of Language Testing Bites. Issue 32.2 of Language Testing is a special issue on language for specific purposes testing with a focus on the assessment of health professionals. This has been a hot topic in many countries around the world as qualified doctors and nurses migrate to fill posts in the health systems of other countries. In the United Kingdom, for example, the National Health Service employs 1.5 million people, and 25% of clinical staff are non-native speakers of English. Safety issues and intercultural communication problems are in the news on a daily basis. Language testing has a very positive role to play, both in identifying necessary language training and screening applicants. In this issue of Language Testing Bites, we're joined by Cathy Elder from the University of Melbourne, who has edited this special edition of the journal to talk about LSP testing in a medical context. Welcome to Language Testing Bites. We're really grateful that you've agreed to talk to the readers of the journal about this really important topic.
Thank you, Glenn, for inviting me. And yes, I agree this is a really important topic, and I think it's almost 15 years since the last special issue of language testing on specific purpose testing came out, so it's high time to revisit the issues, I think.
Before we talk about the occupational English test and the assessment of health professionals, I'd like to ask you about the context in which LSP testing takes place, as there are some pretty deep theoretical issues here that impact on practice. In your editorial, you start off by talking about the concept of authenticity and how this relates to whether we can use test scores to make predictions about likely performance in specific domains. Can you say something about authenticity and why it's important?
Yes, well, authenticity is essentially about the link or the match between the test demands and the demands of the non-test setting. So for test scores to be valid indicators of a person's language ability in the relevant real-world domain, they must be derived from a test which has content and task characteristics that aren't too far removed from those typically performed in the relevant real-world context. And we need to go beyond just a superficial match between the test and real-world tasks. That's what we call situational authenticity. Theorists in specific purpose testing have also talked about interactional authenticity. So what matters is not the task alone, but how the test takers engage with the task when they're performing, whether they draw on context-relevant language skills during their performance. If we can't get at these, we can't make good predictions about future performance. And I guess the other reasons why authenticity, or some degree of authenticity, is important is that authentic or lifelike tasks, if you like, promote positive washback, positive test preparation practices. They help people acculturate to the real-world settings that they're going to be operating in. And they encourage greater buy-in on the part of test users, greater acceptance of the importance of the test.
I think that sets the scene for talking about the test that's the focus of this special issue, the occupational English test. Can you start off by telling us precisely what the OET is, and perhaps say something about its origin and purpose and its content and use?
Yes, well, the purpose of the occupational English test is to assess readiness of non-native English-speaking health professionals to manage the communication demands of the workplace. Passing the OET is the first hurdle requirement in the process of getting professional registration in Australia, and also, I should say, in New Zealand and more recently in Singapore. The test is used by 12 different health-related occupations. Probably won't be able to name them all: dentistry, dietetics, medicine, nursing, occupational therapy, physiotherapy, and a number of others. All of these, so for people in these professions who are seeking to practice in Australia and other countries. The test was designed in the mid to late 80s by Tim McNamara of the University of Melbourne. It was commissioned by the federal government, and it was the basis for Tim's PhD and his subsequent work on performance testing. It's an LSP test, an ESP test, with content built around health-related materials. So there are 4 skills: reading and listening, which are more generic. The tasks are health-specific, but they're generic to all health professions. And speaking and writing, which are occupation-specific. So there's a different task for each of the 12 professions. I'll just give you an idea of the speaking test, which is the focus of the papers in this special issue. It consists of 2 5-minute role-play scenarios, and they involve interaction between a health professional and a patient or a patient's carer. The patient presents with a health problem and the health professional engages in some sort of information getting and information giving, advice on treatment and management of the patient's condition. So the test interlocutor plays the part of the patient. He has a prompt materials, and the candidate is in the role of the health professional. Oh, and I should say that performance on this test is assessed by language experts, trained as raters using the traditional linguistic criteria, things like fluency and accuracy and so on. So it's what McNamara would call a weak language test. Clinical knowledge and clinical competence is assessed separately, and this is legislated in Australia. The language component and the clinical component have to be separate.
I think it's fair to say that the OET is a test that's been the subject of a great deal of research. One issue in particular has had huge impact well beyond the context of this particular test, and that's the notion of the use of indigenous criteria to evaluate test performance. Can you explain indigenous criteria for us, and perhaps say something about the nature of collaboration between language specialists and domain experts?
Well, the need for interdisciplinary collaboration between language specialists and domain experts has been recognised from early on in theorising about specific purpose assessment. And identifying the appropriate criteria for assessing performance is a really important area for this kind of collaboration. The test criteria, which we use to judge performance on a language test, are part of the test construct. And the argument is that these should reflect what matters to domain experts in the context of concern. Research has shown quite convincingly that domain experts and language experts have rather different orientations to communication. So if we privilege the views of the language experts, this is going to be arguably at least a threat to the validity of an LSP test. So Jacoby and McNamara in their 1999 article proposed that we should use what they call indigenous assessment criteria. Those are criteria which are germane to the particular communicative context that we're trying to assess. We should use these in LSP testing. And Jacoby's work was involved a team of research physicists, including native and non-native speakers, observing their feedback to colleagues while they're rehearsing their conference presentations. And she shows, by analysing this feedback in great detail through a conversation analysis, she shows how indigenous criteria can be identified and understood by applied linguists. And the point she's making in her work is really that to get at how domain experts judge communication, we need sustained engagement with a context where their assessments occur routinely rather than simply asking them what they think is important.
And in this special issue, a number of papers treat this topic in some detail, both in terms of seeking the views of domain experts and training raters to use indigenous criteria. Can you outline the research and say what we've learned from it?
The research was a collaborative project involving a team of applied linguists and health professional educators in Melbourne, and it was funded with federal funding from the Australian Research Council through an ARC Linkage Project grant, and also with funds from the Occupational English Test Centre, which is now owned by Cambridge Box Hill Language Assessment, a shared venture between Cambridge English Language Assessment and our local Box Hill Institute. The trigger for the research was really stakeholder concerns about the capacity of health professionals from non-English speaking backgrounds, many of whom had come into the profession via the OET pathway, their capacity to function effectively in the workplace. So we wanted to have a look at this in more depth, and we embarked on this project involving 3 different health professions: medicine, nursing and physiotherapy. And the overall aim of the research was to achieve closer alignment between the health professional stakeholders and the test designers. So the research took place in 3 phases. In the first phase, we were trying to find out what constitutes effective spoken communication from a health professional perspective. So we were trying to get at these indigenous criteria, drawing on the perspectives of doctors, nurses and physiotherapists. The second phase looked at how the OET criteria, which I said before were currently language-focused, how they can be better aligned with this health professional perspective. Can a new set of more professionally oriented criteria derived from these health professional views be used by language raters? That was our key question for the second phase. And the third phase asked the question, what should be the minimum language proficiency standard we require of test candidates from the 3 professions? And what happens when we involve domain experts in making these decisions using samples of performance from the OET? Now, I'm not going to give you answers to these questions now. You can read about those in the special issue. But I guess in response to your question about the lessons learned, I would say the major lesson we learned from the project that applied linguistic notions of communicative competence are really far too narrow, and we need to expand our views to incorporate the values and practices of other groups like the health professionals in this study, who really had important insights to offer. And the second lesson, I guess, is that authenticity is really and inevitably very partial, and this comes out quite strongly in the 2 further pieces of OET-related research which are described in the last part of the special issue. They weren't part of the main project, but they both look at task authenticity. The first was a discourse analysis of candidates' performance on the OET role plays compared with performance on another kind of role play. The clinical role play is recognised as a valid means of assessing clinical competence in the Australian Medical Council exam. And the second study was basically an impact study looking at the perspectives of different stakeholders on the authenticity, if you like, of the OET listening and speaking tasks. So these gave us important insights on what the limitations of the current OET tasks are and perhaps how they could be improved.
Now, I'd like to turn to another topic that brings us back to authenticity. We know that whatever we do in a test is an abstraction from real life and from performance on a small sample of tasks. What we do is make the attempt to predict how well test takers are likely to fare in real-world practice. In a domain-specific test, how do we go about deciding what tasks to include and how many of them we need?
Okay, well, that's a very hard a question to answer, Glenn. I'm not one for giving recipes for language test development, but I can say that, yes, domain description, the kind of domain description you get from a detailed job analysis of the target language use domain is always going to produce perhaps a very rich picture, but also an unwieldy one. You get a lot of information, and we need to select from what we find, somehow identify what is most representative and what is most critical for effective performance. And that is a matter of judgment. We need to consult with health professionals about this, and in the end we always end up having to draw back a bit from the real world context to abstract a bit, as you say, and thereby move away from absolute authenticity. Test tasks are always idealizations of real world situations. So how do we know we've got it right? Well, that's why we do ongoing validation, and that's why we continue to collaborate with domain experts. We need to keep on revisiting our initial design decisions as the communication demands of the domain change, and we need tests like the OET need to be regularly reviewed and evaluated for their relevance and currency. And we need always to settle for compromise. I think the important thing, though, is that we need to be able to defend our compromises, defend the validity of our compromises, if you like.
This is really fascinating, and I'm sure that we could go on talking about LSP testing in this and other contexts for much longer. But in the limited time that we have, this has provided an excellent insight into the issues faced by language testers and others when engaged in high-stakes assessments for specific uses. Many thanks for taking the time to discuss this topic with us and talking about the occupational English test as well.
Thank you, Glenn. And I probably should take the chance to thank my wonderful team of collaborators on this project, particularly Tim McNamara, whose work on performance testing in general and Indigenous assessment criteria in particular was the inspiration for the project. I should also mention John Pill's very interesting PhD thesis on health professionals' communication, which he derived from the Indigenous criteria explored in this study. And finally, I think I've not mentioned a very insightful commentary at the end of the special issue by Barbara Herker, who talks about the theoretical underpinnings of our models of communicative competence and their limitations, and also the conundrums that the special issue raises about specific purpose testing. So thank you, everyone, and thank you, Glenn.
Thank you for listening to this issue of Language Testing Bites. Language Testing Bites is a production of the journal Language Testing from Sage Publications. You can subscribe to Language Testing Bites through iTunes, or you can download future issues from ltj.sagepub.com or from languagetesting.info. So until next time, we hope you have enjoyed the current issue of Language Testing Bites.